All right, I'm going to assess my patient's respiratory system. First, I'm going to inspect my patient. I'm looking at his general appearance, his color, which is appropriate for his ethnicity, his work of breathing. He's not showing any shortness of breath. I don't see any visible retractions. His conjunctiva, I'll take a quick look, are nice and red. I'm going to take a look at his nail beds and his capillary refill, which looks good. He looks well oxygenated to me. I'm going to watch him breathe, and I'm just looking for the symmetry, the rise and fall of his chest and his abdomen. I'm observing the diameter transversely of his rib cage, and I'm looking for anything like barrel chest or pigeon chest. Everything looks fine. I'm going to palpate. Is anything tender?
No.
And I'm feeling for muscle development, intercostal spaces. Take a deep breath for me. Perfect. Chest movement is symmetrical. You say the words 99 for me.
99.
Perfect. Again.
99.
Again.
99.
Perfect. And I'm just feeling for tactile fremitus, which I do feel some vibrations. I'm going to go ahead and listen to his breath sounds anteriorly and posteriorly as well. Deep breath. And up. Deep breath. And out. Deep breath. And up. Good. Again. 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 Lung sounds are nice and clear. I don't hear any ralls, any crackles, any wheezes, anything like that. I'm also going to listen for transmitted voice sounds. So if you could say 99 for me.
99.
Again.
99.
And could you say the sound E?
E.
Again.
E.
Again, I could hear his voice more clearly at the top of his lungs, where there's more air, there's more resonance, and it got progressively dimmer the lower into the lungs we went. I'm going to percuss his lungs now. I'm going to do this anteriorly. Good. So we have a more resonant sound at the top of the lungs, where there's more air, gradually getting more dull as there's more tissue in the way. I'm also going to auscultate for our diaphragmatic expansion. So take a nice deep breath in for me and hold it. All right, exhale. And now this time, do a regular breath in and out and hold the exhale. All right, so these are bigger pieces of paper, but in between, it looks about 3 to 4 centimeters, so that's within normal limits. I'm now going to take a look at his cardiovascular system, and I'm first inspecting him, looking again at his skin color. I'm looking at the distribution of his hair. I'm looking for any edema, especially in a space, any periorbital edema, and everything looks great. I don't see anything of concern. I'm now going to be palpating the patient's carotid arteries, and I'm feeling for any heaves, any thrills. I'm then going to auscultate, and I'm listening for any turbulence or bruise. We always palpate the carotids one at a time so we don't occlude any blood flow to the brain. Perfect. Nice and strong, easily palpable. Good. And I'm going to use the bell of my stethoscope to listen for bruits. You could turn your... Perfect. Good. And the other way. Perfect. I'm going to palpate the chest wall. And I'm feeling for any thrills, any heaves, anything like that. Does anything hurt?
No.
I'm going to have you lie back in the chair. I'm observing the chest wall, looking to see if I can see any pulsations, any beats, any thrills. Nothing visible to me. I'm going to auscultate his heart. I'm going to listen to it in 4 different positions, and I'm going to listen to all 5 points of auscultation. If you can go ahead and lean forward for me. I'm going to listen to the aortic. Pulmonic. Herbs point. Tricuspid. And the mitral. The rate is regular, the rhythm is good. I don't hear any extra beats, I don't hear any extra heart sounds. I just hear S1 and S2, the lub and the dub. Could you go ahead and stand up for me? In the varying positions, I didn't hear any extra heart sounds. The rhythm was nice and regular. The rate was within normal limits. The pitch was fine. No issues as far as the cardiac system. I'm going to now assess his peripheral vascular system. Again, just first inspecting, looking at his upper and lower extremities, looking for color, hair distribution, feeling the warmth of the skin, the turgor, which is perfect. It snaps back with instant recoil. I'm going to palpate his pulses. The brachial is good. I'd say +2, nice and strong, easily palpable. The radial pulse, +2, nice and strong, regular rate and rhythm. The ulnar, +2, very strong with regular rate and rhythm. I'm now going to palpate his lower pulses, starting with the femoral. If you could lean back for me. +2, nice and strong, regular rate and rhythm. The popliteal pulse, +2, nice and strong, regular rate and rhythm. Now going to palpate your posterior tibialis, +2, regular rate and rhythm. And lastly, the dorsalis pedis, nice and strong, +2 amplitude.